Hi everyone. Today we have Dr. Sara Easaw who will be talking to us about men's health from an oncologist's perspective. Dr. Easaw is a board certified hematology and an oncology specialist practicing in Ocean Hematology and Oncology, Lakewood, New Jersey. She will be talking to us about common cancers among men, what can be done for its prevention and early detection. So, Dr. Easaw, please tell us what are some of the common cancers among men?
There are cancers that are unique to men, and then there are cancers that can affect both men and women. Among the cancers that affect men only, the most important one is prostate cancer. Prostate gland is one of the reproductive organs in males. It is located below the urinary bladder and in front of the rectum. Enlargement of the prostate can cause blockage in the passage of urine, and tumors or cancers originated from the prostate can also give similar symptoms. It can cause blood in the urine and pain during urination. Other than skin cancer, prostate cancer is the most common cancer among men. 1 out of 8 men will be diagnosed with prostate cancer sometime during his lifetime. So the next important cancer is lung cancer, and lung cancer is the second most common cancer among men, and it is the most common cause of cancer death among men. Overall, the chance of developing lung cancer for a man in his lifetime is about 1 in 15. These numbers include both smokers and non-smokers. Another important cancer to know about is colon cancer. Cancer of the large intestine, more commonly known as colon cancer, can present with bleeding from the rectum. Sometimes the bleeding can be very subtle and may only be evidenced by a special stool test for occult blood. Colon cancers usually start as benign growths known as polyps, and some of these polyps can turn cancerous after a few years. It is important to do colonoscopy to detect and remove these polyps to prevent cancer. So prostate, lung, and colon cancer together accounts for about 43% of all cancers among men in the US. Other less frequent cancers are pancreatic cancer, stomach and esophageal cancer, cancer of the mouth and throat, and various types of blood cancers.
What are the screening tests for men?
A screening test is one which can identify cancers at an early stage before the symptoms develop. The goal of screening is to provide treatment at an early stage before the cancer spreads, and it will help in reducing the risk of dying from cancer. Screening for prostate cancer should start at the age of 50 in men with an average risk. Those with a higher risk, such as those who have a family history of prostate cancer, should start the screening at an earlier stage like 45 or even 40. Screening is usually done by a blood test called PSA or prostate specific antigen. A digital rectal examination is also part of the screening test for prostate cancer. Most often, these tests are done annually or biannually. If you are 45 or older, you should also start screening for colon cancer. Several types of tests can be used. The stool-based test looking for blood or cancer DNA in the stool is one way to screen for colon cancer. Another additional test is by direct visualization by a colonoscopy. If there is a family history of colon cancer, screening may need to start at an earlier stage, and screening may include both stool test and colonoscopy. Lung cancer screening is usually recommended for heavy smokers. Screening is recommended for smokers present and past, starting at age 55, and it is done by a low-dose CT scan once a year.
What can be done to reduce the risk of getting cancer?
Cancer risk can be reduced to some extent by lifestyle modifications. Smoking is a very strong risk factor for cancer, including lung cancer, throat cancer, bladder cancer, and many more. Quitting smoking is the number one lifestyle modification one can do to reduce the risk of cancer. Heavy alcohol intake is also linked to cancer of many organs, especially the liver. In addition, high fat diets, obesity, a diet with a high glycemic index, lack of exercise, all these are preventable risk factors for different cancers. Limiting direct exposure to sunlight and using protective sunscreen is a way of reducing the risk of skin cancer. And also, most importantly, one has to be aware of any new symptoms or any changes that happen in the body. Get regular well visits and do the appropriate screening tests at the right time. A healthy mind is needed for a healthy body. Trying to reduce stress and staying positive is also very important. Thank you.
Thank you, Dr. Isha, for your valuable insight. A man is a husband, a father, a brother, and a friend. He is a source of support and a provider, and a great joy to be with. Let us take care of the men in our lives. Thank you.